So now implants. So many people nowadays they come and ask what are the type of implants which are available. Okay, there are two different types of implants which are available, a cancellous implant and a cortical implant. Cancellous implant is big in size, cortical implant is narrow in size. Cancellous implants work on osseointegration, meaning we put an implant now, wait for the implant to fuse to the bone. 2 to 4 months after that we give a crown. Cortico-Basal implants, we just use more number of implants, we use longer implants, smoother implants. It gets engaged into the hardest parts of the jaw bones on the top as well as the mandible on the bottom, and then it works on osteofixation process. So this can be immediately we can give a tooth instead of waiting for 3 months to 4 months. When I say immediately, it can be in just 72 hours. Some people, I have even given it at 48 hours. So these are the two different type of implants. So the regular implant, which is 3 months implant, cancellous implants or 2-piece implants what we call, we need to put only less implants, 6 implants, but for one jaw generally. But the other implants, the cortico-basal implants, we may have to put 10 to 12 implants. This is a general difference between both. And depending on the type of patients, depending on the bone quality, we can, even if the bone quality is not all that great, the indications of cortico-basal is if the patient is more than the borderline diabetes, then we give a cortico-basal implants because it is a smooth surface. The second major indication of cortico-basal implants is we avoid the natural anatomical structures, and even if the bone is very small or not dense, and if it is less quantity, and if the patient is missing the teeth for a long time, then we give cortico-basal implants. These are the only two basic differences between regular implant and cortico-basal implant. So if at all your bone is fine, if at all you have time, 2 to 3 months, still you can go in for a regular implant. And if your bone is very less and if you don't have time, please go in and consider cortico-basal implant. But wherever and whatever you do, go to the best possible clinician, maybe a maxillofacial surgeon, maybe an implantologist, maybe a periodontist or a prosthodontist, or anybody who practices implants over a period of many years can help you out. So make your homework, go get your teeth fixed as early as possible. Thank you.